Hello, my Aloha tribe, and welcome to the Aloha Perspective, where you get a little bit of something and a whole lot of everything. Happy Wednesday! It is hump day, and we, whoever joins me, are here to talk about CRPS, formerly known as RSD, which was Reflex Sympathetic Dystrophy, but is now known as Chronic Regional Pain Syndrome. Now, the initials RSD have taken on a life of their own. So, I mean, if you Google RSD, you're going to come up with all kinds of different things, and there are going to be all kinds of different things that you absolutely do not need to know about when it comes to CRPS. So, that's where we start here. All right, so I'm going to read this, and I'm going to tell you the story behind this. And it is you saw my face, not a good story. Does not reflect well, but not on us, but on others. So as just to preface this really quick, as you know, older sibling is she's my best friend. She's been my best friend since basically 1999. We've known each other roughly now 26 years. We've been like sisters for probably about a good 20 years, but we've been best friends. Well, she's been my best friend since almost the beginning. And she has a heart of gold. She is very kind. She's had her own issues throughout life, as we all do. Good morning, Sammy. How are Good morning, Sammy. How are you, buddy? Good morning, older sibling. I saw you pop on. So, but what I'm going to say is that the reason I'm telling you this is because, she is like the least judgmental person I know. She jumps in feet first when it comes to trusting, which drives me nuts. And, but I've also learned we kind of meet in the middle now. But yeah, the reason I want to say this is, back in 1979, so she is a little bit older than me. So she really is like an older sister to me, which is why my nickname for her is literally sibling. I forget sometimes when I'm talking about her and I'm like, yeah, well, sibling. And they're like, well, I thought you were an only child. I am. But when you're an only child, you adopt your siblings. And as luck would have it, she is also an only child. So she adopts her siblings. So I was very fortunate to be brought into her fold. But in 1979, older sibling had a horrific car accident. It was during the time of those naughty tires that just blew out for no reason. And fortunately, she was driving. But they were coming home on this one stretch of road, which is particularly dangerous. All right. I mean, this stretch of road does not have a good track record when it comes to non-accidents, but that wasn't so much the case. But it is a curve of sorts, and the tire blew. Now, because she was a horse trainer, well, she was up until this day. Because she was a horse trainer, she knew how to drive those big gooseneck trailers. And by gooseneck, I mean like the old school, okay? Not like now where everybody's so pampered with the way trailers work. I mean, it still requires a significant amount of skill to drive these things. But this is the old days when they were a little bit harder. So she managed to control the car. It did flip several times. Even the police officer said basically I don't know the conversation they had. I was not there. I was like 6 years old at the time. But even the officer asked her, and he saw if you hadn't had that training, you would be dead. And I think that's when it kind of hit her. But unfortunately, what also hit her was a diagnosis originally then of RSD. Now, RSD is not some magical made up autoimmune disease. It is something that goes all the way back to the Civil War, but they didn't really have a name for it then. And, it probably goes back even further because it is the human body, right? But it is somehow the way the nerves attack the body. And, this doesn't really, okay, so this talks about what they want people to understand. But what I'm going to tell you from my own experience of watching her is there are times she could simply just accidentally whack her hand, like just coming down the stairs. Okay, she might stub her toe or trip on something or accidentally hit her hand on the banister, and that can cause a flare up. Now, with CRPS, they call it chronic regional pain syndrome because for a lot of people, it just happens in the affected area. So like there was one lady we saw a story on years ago, And it happened in her foot, in her leg and her foot, so it would just resonate up to basically about her knee, but it would get swollen. It would feel like, you know, it would just, she'd have a flare up. Okay. But for older sibling, it's full body. It's full body. So that is like, whoo, catch 22, right? But fortunately for her, she has a high tolerance for pain. And that says a lot, because in my opinion, just from judging her, excuse me, I don't know what's happening with my mouth over here, but just from knowing her and seeing what she goes through, to me, the regular pain scale is 1 through 10. That's, I can't remember what it's called, but it has a name, and that's usually what you find in the hospital. For people with CRPS and even fibromyalgia, it starts at about an 11. Okay, I think for fibro people, it probably starts at about an 8 or 9 and then goes up. Now, I'm not saying anything bad about fibromyalgia, but, you know, fibromyalgia is like the, you know, or let me put it this way. CRPS is like fibromyalgia on steroids. It is worse. It's not just a chronic pain, and that doesn't take away from people with fibro or any type of chronic pain. This is like the granddaddy of pains. All right. And, they're all bad, because they all can upend you, you know, rheumatoid arthritis, fibromyalgia, other types of chronic pain caused by different variations of things. But CRPS affects the nerve endings and basically sets them on fire. So even, I'm sorry, I think it's this lipstick. I am so sorry. I'm not trying to distract here, but, oh, here we go. Sorry. There. All good. So anyways, what am I trying to say? I get a little emotional with these because I feel so bad for her, because I just wish it would go into remission, and I don't know why it hasn't, because the last time it went into remission, but then she had spinal surgery in 2005 and it came back. So for the last 20 years, she's been dealing with this again, and it's really upended her life. It's upended a lot of things she can do. I mean, one day she just, I don't know, something in her neck cracked or whatever, and she had no headache. She was fine. And so we made the whole day, her, Sissy Joe, and I, it's like, oh, let's go do something. We ended up in San Diego. But, but yeah, so it's basically like standing in a house that's on fire. That's the way it's been explained to me. And everything, like, you are burning in the house, but you're not, you know, but you're still, whatever it is, you're still alive. You're still all these things. So, older sibling, goes through this. Now, when it's not a flare up, then there's still kind of, she has other underlying issues like arthritis and stuff. And some of these things just come with age. Okay. Now, I'm not calling her old. I'm just saying some of these things come with age. But what am I trying to say? I'm sorry. My brain is just kind of like all over the place right now. It really, you know, when she flares up, let me put it this way. Even wearing clothes hurts. Everything hurts. I mean, and then of course, you know, animals, whether you have a dog or a cat or whatever kind of animal you have that absolutely loves you, which, you know, in the Canterbury Tales are kitties. They try to comfort her and they try to be on her, but she has to remove them. And I think that confuses them a little bit, because they don't understand, why can't I sit on you to make you feel better? But it's because it hurts. Every single nerve ending just flares. And one time, older sibling and I went to that Body Works exhibit, you know, the one where they have like actual human bodies, and then they show you everything. They show you everything, but basically with no skin, right? And we saw all the nerve endings, and I was just like, wow, that looks like an IT server room before everything's hooked up. And all I could think of in that moment, and I even told her, was, shit, that's a lot of nerve endings in your body. And this is the stuff that she has to deal with, you know, but she does it with grace. She does it with kindness. You know, she'll get up going like, and everyone say, are you okay? I'm fine. I'm fine. I hate that. I hate that. It's like, we know you're not fine. We can see your face. you know, and when other people other than me can see it, you know, it's not good. But she pushes through. She's like, I'm fine. I'm fine. But my family obviously has adopted her as well. And they call her whenever they ask about her, it's like, how's sis Laura? So you know, that's why I'm home. I'm picking her up for Thanksgiving. But yeah, so they try to do, you know, for her also. So, and try to make sure she's comfortable. So anyways, this card that I made for her, I'm not bragging about this. I will tell you why I made this for her. After I tell you the story that preceded this piece of work that I did for her. Why do I keep saying that? You are not old, older sibling. She's like, you can call me old. You're not old. You are not old. I mean, you're older than me, yes, but you are not old. This girl has packed a lot into a short life. I mean, it's like, damn. It's like, I haven't even done half the shit you've done. But anyways, older sibling was having a super bad flare. Oh no, she wasn't having a flare up. It was the middle of summer, and I know I've shared this story before, because to this day, and this had to be about maybe 10 years ago, maybe 8 or 9 years ago. I don't know when it was, but it still pisses me off to this day. Does it say when I made these cards? No, it doesn't. So, older sibling had, you know, she had I don't know what happened, but something with her teeth were having problems. And it was a Friday afternoon, and no dentist could get in to see her, no emergency dentist nearby. You know, we live in a county that has stuff, but not everything is close by. And when even just something that's not, you know, that's, you know, having a tooth, an infected tooth can make her flare. And when she flares, she can't drive because she's in so much pain. So, of course, she calls me. I'm going over to the ER. Now, Miss Stubborn down there decides she's going to walk, because they told you there's a hospital that's, you know, our little tiny town's hospital. It fits on one block, you know, but, you know, it's small. And she had a tooth infection. That's what it's called, a tooth infection. Seriously, what is wrong with me? Maybe I need to be tested. Good Lord. And I'm not poking fun at that either. I'm just, you know, when you get to the certain age and you're like, why can't I remember words, you know? But anyways, she ended up having to go to the ER. So instead of asking our neighbor for a ride, which she got chastised for later, like, why didn't you call me? I would have driven you over there. Well, it's right there. It was over 100 degrees that day. It was about 102. And this girl walked, and it's not a long walk, but when you're in pain and when you have a tooth infection and it's causing a CRPS flare up, that is a long walk. Okay. It's like walking through a desert and trying to find the actual oasis. And so she gets there, but she called me first. So of course, the first thing I do is like, I have to go. Older siblings got a problem, and I need to get home to take her to the hospital because she can't drive right now. Okay, no problem. It's Friday, blah, blah, blah. So I go, and I get there, and she's still in the waiting room, and I'm like, oh good. But of course, as soon as I got there, then they take her in. Well, this particular hospital, and I don't know if they still do, and they are owned by a new company now, which is part of a bigger university network. So it's very possible that they just have their own doctors coming in. But at the time, this place wasn't owned by that, and they had traveling doctors. And we had a traveling doctor who was a complete asshole. He took one look at her. Okay, she's a little disheveled because she walked over. It's hot outside, and she's in pain. She's in pain. And at the time, she did have a missing tooth because sibling had, you know, I'm sorry, sibling. I probably should have shared that. But, you know, she had it fixed. But the doctor just took one look at her, and before even asking her what was wrong, I'm not giving you drugs. And I'm sitting there like, okay, look, I'm going to tell you this route right now, okay? I am going to be very verbally obnoxious. And by that, I mean, there are words that are going to come out of my mouth that you only hear in those action movies, okay? That motherfucker I am sitting there, and that's exactly, I'm in my head, I'm like, are you fucking kidding me right now? I mean, I'm in my work clothes. I'm not disheveled. And it's like I'm not even in the room with this guy. And I'm sitting there, and older sibling is just holding her hand down, like, don't worry. When he wasn't looking, I mean, he wouldn't even really look at her. I mean, this man took one look at her and judged the shit out of her. That is not a good doctor, in my opinion. Anyway, she kept telling him, I don't want drugs. Of course, her big mistake was, I have enough meds that I could probably put Orange County in a coma because of her RSD. They give her certain medications, and one of them is a extended release pain medication, but it's on a higher scope of pain medication. And thank you, Sammy. Sammy said, I would have been just as furious as you were. I was beyond furious. I was ready to jump over that bed and just pin that guy to the wall. And he was taller than me, okay? But this is my sister. And that's why I wanted to preface this with, that's why I call her sibling. Because I get very mama bear when people mess with my people. This girl is in so much pain. I have seen her when she flares. We have been roommates for God knows how long. I told her we're going to end up like the Delaney sisters and be like in our hundreds, just being sisters and living in some giant house with 5,000 cats. So, she said she had enough drugs to put LA in a coma because of her RSD. So she did tell him what she had. But all he said is, I'm not going to give you drugs. And I'm all like, you heard her, right? She said she doesn't need that. She has a tooth infection. And then his shoulders seemed to kind of relax. I do remember that. But this guy would not even apologize to her. He just stuck to his guns being an asshole. And I was furious, but she would not let me say a thing. I was able to interject a few things and whatnot. All she wanted was antibiotics. So he says, well, why don't you go to a dentist? My dentist told me to come to the ER because it's afternoon and there are no appointments and they're getting ready for the weekend. They're out, they're going, they're leaving. Well, can't you find an emergency dentist? And she's all, I can't drive when I have RSD. And then he's all, well, you have someone there. And I'm like, I just came from work. And it's like, hello, she needed to get to somebody. And honestly, I'm not even sure we have emergency dentists out here in Orange County. I'm being perfectly honest. San Diego County, LA County, but Orange County is kind of like that, that youngest sibling that just kind of stuck in the middle all the time, right? And everybody's always like looking after them, but they're off doing their own thing. And, so anyways, he just kept getting worse and worse and worse. I was getting more livid. Okay. And she is literally, and she's all, do you even know what RSD is? And he's like, no. And I'm just like, it's an autoimmune disease that affects the nerve endings. And of course, I wasn't helping with my attitude. But this is what pissed me off even more. So he says, well, I'll have a nurse. He's all, I wrote up some orders. I'll have a nurse come, deal with this. He goes across the hall to the other curtained area where there's an older couple dressed very nice. They look like they just came out of their air-conditioned Cadillac. And she's all, oh, my RA is flaring up. And you know what he says? Well, can I give you some pain meds? Motherfucker. I was so pissed. And I was not quiet about it. And I'm all, are you fucking kidding me right now? He looks at you and treats you like you just walked in off the streets. And then he goes across the way and treats these people, like the house just landed on the Wicked Witch of the East and, Dorothy popped out. I was angry. Even the nurse came in. He's like, are you okay? I'm like, no, I'm not. I said, I am angry at the way he's treating my sister. And I hope he heard all of that. And I will tell you, I'm not a person that goes to complain about people, but I escalated that up in that hospital because I was fucking pissed. And I said, you need to do something about this or I'm going to get a lawyer involved. Because I said, there was never a level of disrespect that I have been, a witness to in a hospital room as that day. And I said, my sister has enough to deal with without having some jackass come in thinking he knows everything and treating her like she just walked in off the street. And mind you, those people who do walk in off the street, they have an addiction. They have an addiction that needs to be helped. We should be treating them with kindness as well, because do you really think they want to be like that? They are literally one use away from possibly dying. And I know we all get judgy when we see that. Oh, they're using drugs again. But I've seen enough stuff now. Sibling made me watch Dope Sick, okay? That was a great movie about the opioid crisis. And it really kind of changed my mind. It's like, oh my God, these people, it's like we treat them so shamefully, but they need help. They need help. And it's so hard to ask for help because detoxing is a bitch. But here's the thing. When older siblings' RSD first came back, she was talking to her doctor before he sent her to a pain management doctor. And he said to her, she's all, I don't want that because I don't want to get addicted. Sibling has an addictive personality, but she also had a mother who was an alcoholic. So she is a child of an alcoholic. And she did not want to be on something that she was afraid. And I told her, I said, look, yes, the body gets addicted, but your mind also gets addicted. You constantly feel like you need more and more and more. I said, the doctor and I basically tag teamed. And I said, what the doctor's trying to tell you is that you are mentally strong enough to not be, mentally addicted to this. You will get physically addicted to this. And when your RSD goes away, they'll wean you off. She was still resistant for a little while, but eventually, and then they got her to a pain management doctor, and the pain is still there, but they manage it for her. And so they manage all her meds and whatnot. But this is what CRPS is. This is the life that people have. They end up isolating because they're too, they may say, yeah, let's go out and, I'm going to have coffee with you tomorrow. And like I said, they may sleep wrong. They may, hit their gums with their toothbrush. They may, hit, like I said, just walking down the stairs. And I say that because every so often I hit my hand. So I hit everything. Okay, I'm a klutz. And being a klutz and having CRPS is probably not a good thing. So to all of you who have CRPS, I hope you're not a klutz like me. But just hitting one little thing, even stepping wrong, can cause a flare-up. And so eventually people stop asking you to do things. Or you sit there because you're trying to push through all this because you want to be with people. And they're like, are you okay? Are you all right? And then they have to worry about being pitied, which most of them do not want to be pitied. Most of them just want to be treated normally. And, it's not easy. It's not easy. But after that interaction with that doctor, see, look, all these years later, it's still pissing me off. I made her one of these. And what I'm happy to know is that in the last 10 years, CRPS or RSD has become a little bit better known. It's kind of like, we talked about pancreatic cancer on Monday and how people are like, I don't have that because it doesn't run in my family. Well, it's also not the most talked about cancer, right? We talk about breast cancer, we talk about prostate cancer, we talk about colon cancer. Those are the three main biggies that we talk about. We don't talk about ovarian cancer. We don't talk about all the other cancers. Maybe leukemia, right? Because leukemia seems to be a big one too. And they're all big, but these are the ones we don't talk about. So we talk about fibromyalgia all the time, but nobody talks about CRPS. And I think some people who have fibromyalgia have actually been misdiagnosed because some of their symptoms and some of their pains actually mimic more of CRPS than they do fibromyalgia. Because like I said, CRPS is like the granddaddy, okay? I mean, if there was a family tree, this would be the root. And then it just trickles down to all the other chronic pains. And so, it's its own entity, obviously. But what I'm saying is, as far as the pain goes, it is the granddaddy of pains. And I think there are some people with fibro who have been misdiagnosed. And I'm only saying that because I have a few friends who have it. And I'm like, are you sure? And they actually went and checked with their doctor. And the doctor looked it up and retested them. And they're like, oh, yeah. And it's like, so then they got on the proper treatment that they needed. Even though fibromyalgia and CRPS are very similar, because they're different in their own ways, the treatments can be different. So anyways, this is what I wrote for her and made for her, and I'm going to read it to you now. I have CRPS, complex regional pain syndrome, also known as reflex sympathetic dystrophy. Doctors do not know why it develops or what causes it, but CRPS is a nerve disorder that usually occurs after a traumatic injury, a surgery, a sprain, a fracture, or a period of immobilization. The principal symptom is pain, dramatically disproportionate to the injury. CRPS can lead to disability. CRPS can spread through the body. So this is written in her terms, okay? I wrote it from her perspective. So my skin may swell, sweat, change colors, change temperature, or hurt to the slightest touch. I may look healthy, but I often suffer unbearable, unrelenting, and burning nerve pain. The McGill pain scale, that's it. The McGill pain scale rates the pain of people with CRPS higher than that of people with cancer. Often it is difficult for me to sleep, so I may have trouble with concentration and attention. I may be taking powerful medications prescribed by my physician with many side effects that may affect how I feel or react or get sleepy. It is often hard for me to keep my body steady or easily move. Chronic pain, like that caused by CRPS, often leads to depression because we undergo significant and often negative life changes. I have good and bad days. My pain may even change hourly. Stress increases my pain. Presently, there is no cure for CRPS. I always hope because of the support of my family and friends and ongoing research. Here is how you can help me. My pain is real, even though it is invisible and may not be readily apparent in my demeanor or activities. I am learning various coping mechanisms to get through the day, but the chronic pain is always there, so I cannot predict how I will feel each day. Sometimes it hurts to be touched anywhere, so please ask before you touch me. It's okay to ask me about CRPS, or you can visit www.rsds.org and learn all you can. Now, I'm not sure if that link is still, I guess we can look it up, right? rsds.org. Let's see, I have my journal on here. rsds.org. Oh, sorry. I have my journal sitting here, so it's a little in the way. Ah, yeah, it sure is. Supporting the CRPS community. So there you go. You can go to rsds.org and find out more. You can donate. You can do events. There's advocacy, media, community research, living with CRPS, about it, the 2025 conference, and home, right? I just was reading everything. But you can also email them, info@rsds.org. So now, here's the thing. She's shown other people this, and not everybody really takes the time to look at it. So she's always offering, I can leave this with you. But this is the sad part. It's sad that I had to make this card for her. Not because she has CRPS. I mean, that's just sad in itself. That it hurts my heart that she has this. But because there are so many people who are uneducated in it. There are doctors and nurses who have never even heard of RSD or CRPS. Well, we're going to call it CRPS now because RSD is just, it's like I said, if you look up RSD, you're going to come up with 1,000 different things. Someone she knew actually said, well, it's all in your head. She's like, no, that's a different RSD. And they're like, oh, but here's the thing. So this is how much it means to a person. A couple years ago, I had the opportunity at older siblings pain management office, her doctor's office, to meet someone that became a friend. And I asked her, we were talking and this and that, and we were talking about older sibling because she's a huge advocate. And I said, can I hug you? I said, are you okay to be hugged? I said, I really want to hug you, but I don't want to touch you if you're hurting. And she got misty-eyed. I'm like, are you okay? And she's all, nobody ever asks. People just usually just reach in and hug me. And I think as someone who's a partial caregiver to older sibling, because she does do a lot on her own, especially this last year when I've been down with my dad helping him, that means a lot to them. And I don't think it meant a lot to her because I asked her if I could hug her. It meant a lot to her because I think in hindsight, she felt seen. She didn't have to explain what was wrong with her. She didn't have to say, oh, well, I'm flaring today. But, she was in a good place that day and I was able to hug her. But she says, people just don't normally ask. And she's all, sometimes it makes it hurt more and it makes the flare worse. But the fact that she teared up in front of me, it really, I think, drove the point home that those of us who don't have this, who don't struggle with CRPS or any kind of chronic pain, we really can't understand what they're going through. Now, I promise I'm not trying to make this about me. But I know there's a lot of people like me. I had heart surgery when I was 3. And I think for me, there's a different perspective on it, because I was my parents' only child, okay, as I mentioned before. And so I had a lot of restrictions put on me growing up, like, well, you shouldn't do this, you can't do this, especially before I even hit 10, right? I want to play tug of war. No, you might hurt yourself and fall down, and we don't want your chest popping open, and like that was going to happen. But still, the surgeons did a great job, Mom. My chest was not going to pop open. But it kind of put it in me that there were things I could not do. And so whether it was, wise to limit me or, intentional grounding because, she was right, I don't know. But because of that, I come in from a different area. See, people over here who don't have chronic pain all the time will look at her and go like, oh, well, blah, blah, blah. So she takes it like, well, I want to be able to do all these things. So older sibling was a horse trainer. By the time she was 16, she had graduated from high school and she was horse training full time, and she was training other people. One of her best friends, who's also like a sister to her, was one of her students. And same with Sissy Joe. These are 2 people who were very active growing up and doing things I only dreamt of being able to do. And so I try to tell people, and the reason I'm bringing this up and bringing my thing up is because I want to tell people, look, it's hard for somebody who has been healthy for a good chunk of their life or a good portion of their life, and then suddenly there's just a wall that they run into with their health. It's hard for them to readjust. And that's why I wanted to share where I was coming from, because it took me a while to understand. It's like, yeah, but I've been limited my whole life. But then it dawned on me. I really don't think I've been limited my whole life. I think that was just ingrained into my brain. An older sibling has taught me how to step out of that shell, how to just, throw caution to the wind and just do it. There's still some things I will not do. I will not jump out of a plane. She wants to jump out of a plane. I will not jump out of a plane. But my point is that I think the reason I wanted to share that is because when you have able-bodied people who don't understand chronic pain, who have been able to do things limitlessly by their own choices their whole life, and then they see somebody with CRPS or chronic pain in general, it doesn't really hit their brain that it's an uphill battle. You want to get better, but it's hard. For instance, I'll use my dad. My dad was diagnosed with rheumatoid arthritis. Well, the drugs that he's on, the meds they gave him, it actually kind of it looks like it put it into a bit of a remission. Okay, there's no flare-ups, there's no nothing. It's not registering on his blood test. That's why he still has to take the meds to keep it at bay. But because he was misdiagnosed for almost a year and a half, he couldn't do a lot of things. He couldn't move around a lot. People started just being like, well, whatever, whenever you feel like coming out of the house. And they didn't understand what he was going through. And because of being with older sibling, I do to a degree. But now it's a mental fight, I think, in my personal opinion. Don't tell him I said that. I don't think he watches my show, so don't tell him I said that. But I think it's a little bit of a mental fight. And I think a lot of it really is physical. And there is some fear there because when he was trying to be more physical, he started falling a lot. And it's just because his body had been weakened. And that's the same with older sibling. Watching her get up from a chair, if you're a person who doesn't understand, you're going to be like, wow, that lady doesn't look old, but she acts old. And because you don't understand that she has this affliction. And she's not the only one. Now, I do have a friend that I met through the other friend I talked about that I asked if I could give her a hug. And this girl has become a bit of a spiritual advisor for me, but also a very, very good friend, my friend Debbie Hall. And I'm telling you that because she runs a site for people with invisible illnesses, basically a safe RSD CRPS site. But they allowed me in because my invisible illness is my mental health. I'm not laughing at that. It's just the truth. But I think what we have to do is allow ourselves to see that, being people who have been active their whole life suddenly becoming kind of put on the back burner, and not knowing how to function, not knowing how to readjust. I think that's where the biggest thing is, just being go, 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 go. And, for years, older sibling was in remission and she was go, go, go. There were some times that it would flare up, but then it would just go back to normal, and it would be fine. So it was very rare when she would have a flare up. And then, like I said, after her surgery, it woke the demon up. So, oh yeah, she says it's also because I broke my back when I was younger. Horse trainer. She's broken her back. She's broken legs. Oh yeah, here's a genius move. I'm going to share this one because it always makes me laugh, because I still think, what the fuck were you thinking? But when she broke her leg, she would not let them take her boot. She would not let them cut her boot off, because she saw they were $500 pair of Italian boots, and I saved up for a long time for those, and they were riding boots. And so, so they didn't. But, fortunately, like I said, for her, she has a high tolerance for pain. But yeah, she soaked her cast off in the tub so that she could compete that day. I'm like, why didn't you just go in the backyard and get a bucket? I don't know. I wasn't thinking about that. Oh, her father was not happy. Now, when she broke her back, this is funny, okay? They didn't really know. They had to get her to the hospital. So, but the truck that they were bringing her in, because they didn't want to put her in a car because they didn't want to bend her. So they tied her down into the back of a truck. But I don't know, sibling, you have to remind me, did the bed have a tailgate or no? But she saw people kept going by. Are you okay? Are you being kidnapped? Because they didn't know how else to do this without hurting her even more. So just like, I'm just sitting here trying to imagine what all this stuff looked like with people driving by. Like, oh my God, why is this girl tied down in the back of a truck? It's like, and she's probably laughing her ass off. I mean, knowing her, she's probably just giggling at all of it while she's in pain. But that Monty Python song, Always Look on the Bright Side of Life. I can't remember all the words, but when I just think of the refrain, all I can think of is her and how she just deals with this and how she goes through it. Oh, but I was talking about my friend Debbie. My friend Debbie did go into remission. She had to do a lot of things. She had to change she completely had to overhaul her diet. She did lose a lot of weight, which I think helped her. Sibling, by no means. I don't know. To me, she does not look big. She looks thin to me, but she does have a very small frame because she's only about 5'1". So she does have 5 3/4. But, I'm sorry. She's 5 3/4, but I always say 5'1". So she said, no tailgate. Yes, I was laughing because they tied me spread eagle to the back and there was no tailgate. That was it. That's why it was so funny. Like, are you okay? Are you being kidnapped? It still makes me laugh, and I wasn't even there. I can only imagine. I'm dying. It's like, seriously. But you know what? I told her, I said, at least people cared enough to ask. I mean, it was the 70s, okay? And, the 70s were rife with serial killers. Well, there's always serial killers. But yeah, with teenage girls disappearing. So anyways, I know we're a bit all over the board on this. And like I said, I promise I wasn't trying to take anything away by sharing my own experience of what happened to me as a child, because I wanted to kind of give people an understanding of why they may not understand why this person with CRPS just doesn't push through it. And I had to learn that the hard way too. And that's why I wanted to bring up being limited, because I'm like, I see her doing stuff with her chronic pain. And I'm just like, wow, you know what? If I had had that kind of gumption when I was younger, I would just been all over the place. But I forget too. And it took me a long time to adjust to that. And then that's when it hit me one day. It's like, I've always been in my mind, mentally limited because of, growing up and my mom not letting me do a lot of things. Whereas older sibling and Sissy Joe, older sibling was a figure skater. Then she played on the first, LA's first youth girl hockey team, set up by Stu Nahan. And, she was just, she has a scar from getting cut by a skate. This girl was gymnastics. If there was anybody you wanted to be for the first 21 years of your life, it was older sibling. So, yeah, she was just very active, very go, 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 very rah, rah, rah. So, I think because of that, I thought, well, just go back to being that person. That's why I talked about what I went through, because I couldn't understand. And when I finally understood, and when I finally really started her really needing me to help her, from time to time, it was an eye opener. I never judged it, and well, I did judge it. I'm not gonna lie. Here's the portion where I throw myself under the bus again. I judged it because I didn't understand. Because I thought, well, shit. You're so able-bodied and you're so this. It's like, what's the problem? And it took me a while to really understand it. When I saw her first flare-up, even that didn't, But then over time, we got into a bit of a row. And she's like, well, you just don't understand. And, the first time somebody said that to me, I was mad. But I did try to do my homework. And I did go onto the internet. And I thought, you know what? Maybe she's right. Maybe I don't. That was after I hemmed, hawed, and yelled. But this is before my healing. So as a hurt person hurting people too. But yeah, I did my homework. And I was kind of dumbfounded. And so then I started the apology tour for that. I do a lot of apology tours. But, it does drive me nuts now when people say that. Well, you just don't understand. Oh, sorry. I turned off my computer, so the light went off. You just don't understand. It's just like, I try to understand. I can't understand because I'm not in your body. But I think that's where I wanted to come from with all of this. Despite all of our own limitations in life, when you meet someone with chronic pain, treat them with dignity and treat them with respect. Because even if they're showing you this smile and their I'm fine when they're out in public, they're anything but when they're at home. They struggle. They have trouble doing things. They might do things about 5 times slower than somebody else because they're hurting. They may not be in a flare-up, but it's called chronic pain, which means the pain is always underlying. Think of it as like a pilot light on a stove, right? Until you turn the stove on, the fire's not going to be there, but it's always lying just beneath the surface, ready to be switched on. So it's kind of that hidden enemy that sits within somebody that's just a jerk. So anyways, so that is my CRPS awareness. I hope everybody has a wonderful, wonderful day. Please, 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 please take care of yourselves. Older sibling is a gem. I hope for her every day that she goes into remission. Anybody who has this, affliction of any kind of chronic pain. Like Sammy said earlier when we were talking about the addicted people, they do need help. And it's not always easy to ask for help. Now, there are times when they're advised to just, cut off the family member. And that might seem cruel, but sometimes that's the only way. So, I'm not an addiction expert. I'm just saying that, we can judge people. We can judge homeless people. People are homeless for a reason. People are addicted for a reason, one reason or another. But I think if we want to be good humans, even if we can't help them, the best thing to do is just, if you're a prayer, pray. If you're not a person, if you're an agnostic or an atheist and you don't pray, then just good vibe them. Send them good vibes because maybe that's all they need. Or just be compassionate. Compassion and empathy, some people say empathy is a weakness. Empathy is not a weakness. Empathy is a strength. And so is compassion, because not enough people show it. You know, and I think we need more of that in this world, especially right now. We need a lot more of that in this world. We need more compassion. We need more compassion, more empathy, and just more kindness, period. And to any nurse or doctor out there, you know, I do apologize for taking down your colleague with such rough words. I was angry. I'm still angry at that doctor, and I hope that he learned something that day. And, you know, before I could even come out of the curtain and talk to him, he was gone. And I think it's because, I don't know if it's because he was busy or what, but there was nobody else in the ER. You know, I like to think in my small mind that maybe he just didn't want to deal with me, but I was ready to throw down verbally because I was mad. I was angry. And trust me, when I throw down verbally with a professional, I don't get all mouthy like I do on here. I sit there and I just tell them, and I spew every fact I can think of. But that was my sister, and she was treated awfully. She did get her antibiotics, but not before it hurt her. That's all she thought about for a week. Am I that bad? Am I that, you know, blah, blah, blah. I mean, she questioned everything about herself because of one interaction with the doctor that all she was asking for was antibiotics for her tooth infection because her doctor told her to go into the ER. We got to be better. Medical professionals have to be better. I get excited. So I'm half Filipino, which means that pretty much half of my family are nurses. It's just a fact. They work in the medical field, whether they're pharmacists, or pharmacy techs, or nurses. Okay, but when I find out that they know what it is, I get excited. I truly get excited because that's a win. That's a win for the CRPS community because it means somebody knows what RSD is, Reflex Sympathetic Dystrophy, that is. And that's a huge win. And we don't, this disease doesn't have enough wins. Pancreatic cancer is making a push to be known, up there with the biggies, and of course there's just all kinds of cancers, right? Liver cancer, ovarian cancer. I don't think ovarian cancer has a cure either, but RSD or CRPS can go into remission. Fibromyalgia can go into remission. But it does take effort. It does take a lifestyle change, and and that's not even a guarantee. Sometimes you wake up and it's just gone. So, anyways, I hope everybody has a wonderful, wonderful day. I will not be on tomorrow. Tomorrow is Thanksgiving here in the United States. So, I will see you next Monday, 8:30 a.m. Pacific Time, Facebook Live. All lives are public under Shelley Marie Lucas. You can find me across the social media board, YouTube, all those places. Okay, so I hope you have a wonderful, wonderful day. Thank you so, so much for watching. Thank you for putting up with my sailor mouth. And please just be kind to everyone you know. Even the mean peoples. I think sometimes the mean people need the kindness the most, right? But even when it's hard, just smile and walk away. And if they keep trying to go after you, But yes, and a happy Thanksgiving to all of you who do participate or who do, observe. I guess who do observe. Muddy, I hope you have a wonderful Thanksgiving. I forgot to ask you a couple days ago how your Friendsgiving was. Was that last week or was that this week? I can't remember. I'm sorry. My brain. But yeah, I hope you all have a wonderful, wonderful holiday. And to everybody else who is around the world, have a great Thursday and a great Friday, and everybody have a safe, safe weekend. Have a great day.